Hello students of 4th semester. In this video lecture we will discuss about the basic retrosynthetic analysis of the drugs such as analgesic agents, antipyretic agents, anti-inflammatory agents uh, which are included in your syllabus such as aspirin, paracetamol, ibuprofen and the antibiotics chloramphenicol. We will study their usage and their side effects, and then we will study their retrosynthetic analysis followed by their forward synthesis. Aspirin, you all know, is used in the treatment of a number of conditions including fever, pain, headache, rheumatic fever and inflammatory conditions such as rheumatoid arthritis. Lower doses of aspirin have been used to reduce the risk of death from heart attack or the risk of stroke in people who are at risk and who have cardiovascular diseases. And aspirin is given to those patients, particularly in United States. And also, it was found that there is some evidence that aspirin is effective to prevent colorectal cancer. Although this is a good drug, however, it has several side effects when taking in excess or for prolonged exposure to aspirin has many side effects, such as aspirin causes high risk of gastrointestinal and stomach bleeding, and aspirin is known to cause hemolytic anemia in people who have the genetic disease glucose 6-phosphate dehydrogenase deficiency. This is a symptom or a disease. This is a condition causing red blood cells to break down in response to certain medication in infections or other stresses. So those who have this disease should not take aspirin because then they will have hemolytic anemia. And aspirin has several other side effects, such as it is not recommended to take the dengue patients because it will increase bleeding tendency. And people with kidney disease or gout should also not take aspirin because it inhibits kidneys function to excrete the uric acid and may increase the uric acid level in the blood. And also aspirin should not be given to the children because it causes some diseases such as Reye's syndrome, acute encephalopathy and fatty liver. This is called Reye's syndrome, and tinnitus. This disease is basically people who have this disease will hear the sound of ringing bell when actually there is no external sound present. And taking aspirin can result in symptoms resembling to allergic reactions, swelling, headache, etc. And it can also increase stroke, Alzheimer's disease, intracerebral hemorrhage, etc. So it is clear that aspirin has a long list of side effects, so it should not be taken by yourself. Only it should be taken when doctors prescribe you. And I also previously told you when I discuss about the prodrug approach that the actual drug is the salicylic acid in aspirin. However, the phenolic OH group causes the gastrointestinal ulcer and bleeding and etc. So it has such strong side effects. That is why the phenolic OH group has been blocked with acetylation with the esterification. So upon esterification, its side effects has been reduced, and in the system of our body this extra functional group has been removed by hydrolysis, and the actual drug the salicylic acid is removed to the system. So the retrosynthesis of this drug aspirin can be done by this. Salicylic acid is a commercially available starting material. So only by esterification of the phenolic OH we can directly reach to the drug aspirin. Actually, it is a prodrug. So the acetylation we can do by adding acetyl chloride or acetic anhydride. So it will give the acetylated salicylic acid, actually the aspirin, and will release HCl or acetic acid, whatever the case may be. Okay, so next we will study paracetamol. Is a widely used antipyretic agent. Antipyretic agent means those who are used to reduce the fever, and analgesics also, it acts as analgesics also. Analgesics means those who are used to reduce pain. So paracetamol is used for both analgesic and as used for reducing pain and also for reducing fever. It also used for arthritis pain of the hip, hand, knee and lower back pain. In contrast to aspirin, paracetamol doesn't prevent blood from clotting. Thus, it may be used for people who have concerns with blood coagulation. So we can see here that paracetamol has lesser side effects. Actually, paracetamol is the most safest drug for treating fever and pain. It is not absolutely safe because it has some other side effects. For example, acute overdose of paracetamol can cause fatal liver damage. The recommended dose for an healthy adult is like 2 to 4 gram per day. So if excess paracetamol is used, then irreversible liver failure can happen, which can lead to death. The drug could cause rare or possibly fatal skin reactions, and paracetamol might cause asthma. However, there is debate about these side effects. And also paracetamol has association with increased risk of kidney cancer. Now we will study the retrosynthetic analysis of paracetamol, how we can synthesize paracetamol. You see, this is like para-acetyl aminophenol. So in the retrosynthetic analysis, we can first disconnect the amide functional group to have the para-aminophenol. This para-aminophenol we can get from para-nitrophenol, and para-nitrophenol, we can synthesize from phenol by nitration. So in the forward direction, we will first do the nitration on phenol, followed by the reduction, and then followed by the acetylation. The synthesis of paracetamol is very simple. Even you can do it in laboratory, in undergraduate laboratory also. Okay, next we will study the usage and side effects of ibuprofen. Ibuprofen is also act as an anti-inflammatory, anti-analgesic and antipyretic agent. Anti-inflammatory means it can be used in inflammation. Inflammation means there is some reddish or some swelling tendency on some wound or like arthritis, etc., etc. These are called inflammation, and ibuprofen is used primarily to treat fever, including post-vaccination fever, mild to moderate pain, including pain relief after surgery. It can be used for osteoarthritis, dental pain, headache, during migraines, and pain from kidney stones. and it is used for inflammatory diseases such as juvenile idiopathic arthritis and rheumatoid arthritis. Also, ibuprofen have some side effects. All the drugs have side effects. Adverse side effects include nausea, means vomiting tendency, dyspepsia, means indigestion, means your digestion system will not work properly, diarrhea, you know all diarrhea, constipation, gastrointestinal ulceration, bleeding, headache, dizziness, rash, high blood pressure, etc. And infrequent adverse effects include heart failure, high blood level of potassium, kidney impairment, confusion, and bronchial spasm. And chronic ibuprofen use has been found correlated with the risk of hypertension and myocardial infarction, means heart attack. So longer exposure to ibuprofen can lead to heart attack. Also, it is associated with some allergic reaction on skin, like skin blistering and diseases like that. So you can see that ibuprofen has some severe side effects if given in higher doses or for longer period of time. And we will see the synthesis of ibuprofen. This is the structure of ibuprofen. This synthesis is taken from the Journal of Chemical Education, published in 2011. Actually, this procedure can be utilized in the general in the undergraduate level laboratory. It doesn't require like sophisticated laboratory setup. So we will see how we can synthesize ibuprofen. First, you see there is a carboxylic acid group which we can disconnect here. I already taught you how to make carboxylic acids. It can be done by treating the Grignard reagent on carbon dioxide. You all know that. So this negative charge, as I told you, can be generated from Grignard reagent from an alkyl halide. Here it is taken as alkyl chloride. So this alkyl chloride can be synthesized from alcohol. The alcohol can be obtained from the carbonyl compound. The carbonyl compound can be obtained from acylation via the Friedel-Crafts reaction, and this alkyl this benzene substituent, benzene derivative with this alkyl substituent can be obtained from benzene. So in the forward reaction, we will see first there is Friedel-Crafts acylation to incorporate this carbonyl group, which can be reduced by zinc amalgam HCl to reduce the C double bond O to CH2. You all know this reduction very well, followed by the Friedel-Crafts acylation again to give this carbonyl compound here, and now we will reduce with sodium borohydride to produce the alcohol. The alcohol is converted to alkyl chloride by treating with HCl. Then the alkyl chloride is transferred to the Grignard reagent using magnesium and ether, and then the Grignard reagent is treated with the carbon dioxide followed by acidification to give the ibuprofen. Okay, so you all understand that all these steps are very familiar to you. I already taught you all these steps in the retrosynthetic analysis course. Also, I will talk more about the retrosynthesis in other video lectures. Okay, next we will discuss about chloramphenicol. The previous three drugs we discussed, like paracetamol, aspirin, and ibuprofen all are antipyretic agent, analgesics, and anti-inflammatory. But we will study now the chloramphenicol. This is an antibiotic. It is a broad spectrum antibiotic, means it can be used for a wide range. It can be used against a wide range of bacteria and number of bacterial infections. This includes the use as an eye ointment to treat conjunctivitis, or conjunctivitis. It can be used against this. And chloramphenicol can also be used to treat meningitis, plague, cholera, and typhoid fever. It may be used with caution if there is no available alternatives. So there are also side effects of chloramphenicol, which includes the bone marrow suppression. Bone marrow suppression means there is some problem with the formation of bone marrow cells, and bone marrow, the processing bone marrow development doesn't function well, so that there is lack of bone marrow cells and etc. So you can have more idea about bone marrow suppression from Google. Also side effects like nausea, diarrhea, and the bone marrow suppression leads to the aplastic anemia. So the red blood cells in our blood are very important for transporting oxygen, and also very important for our livelihood. So in our blood, if red blood cells are reduced, then we have anemia. You all know that, and this anemia is caused by bone marrow suppression, which is a severe side effect of chloramphenicol. If it is treated against children, it can cause leukemia, such as blood cancer, if it is used prolonged. And also it can induce hypersensitive reactions, including fever, muscular and vesicular rashes. It is also neurotoxic. It can cause headache, mild depression, and mental confusions. So now we will study the retrosynthetic analysis of chloramphenicol, followed by the forward synthesis. And you can see here, this is the structure of chloramphenicol. This is an optically active compound. It has two stereoisomers. First, in the retrosynthesis, we will disconnect the amide functional group here. So this will lead to the amine, and this amine, the enantiomerically pure amine, will be obtained by the resolution of the racemic mixture. So this racemic mixture we will synthesize, and after resolution we will get this optically pure amine compound. So we will discuss how we can do the resolution later. So this amine, which contain a nitro group here, can be obtained from the nitration of this compound, and this compound, which contain amine, can be obtained by the reduction of this nitro group. And this multifunctional group can be obtained by the nitroaldol reaction on the benzaldehyde. So you generate here an anion which will attack here on the aldehyde to give the alcohol, and this nitroalcohol, 1,2-nitroalcohol, can be obtained from nitromethane treating with the formaldehyde in presence of a base. So first, nitromethane treated with benzaldehyde in presence of KOH will give the nitro alcohol, which are situated at 1-2 positions, and this compound, when reacted with benzaldehyde in presence of sodium methoxide, a strong base, will do the nitroaldol reaction to give this racemic alcohol, which contain the nitro group, and then the nitro is reduced to the amine, and here an additional step has been added. The both alcohol and amine groups are acetylated strongly, so that all alcohol and amines are acetylated by acetic anhydride in presence of pyridine. So this is actually done to facilitate the nitration. Otherwise, some side effects are formed which are difficult to separate from the starting material, so difficult to separate from the product. So on this heavily acetylated compound, nitration is performed in presence of nitric acid and sulfuric acid nitrating agent, and then the acetyl functional groups are hydrolyzed by HCl to give the amine. So you see here, this amine is obtained in racemic mixture. This is then resolved by D-camphor sulfonic acid. D-camphor sulfonic acid is an optically active, naturally occurring acid functional group, sulfonic acid. So this will form diastereomeric salt with this amine. So you know, if there is an acid and amine, they will form salt. So this D-camphor sulfonic acid will form diastereomeric salts, two different salts. So it will form salt with the D form of this and also with the L form of this. These two diastereomeric salts will have different physical properties, and like melting point and like crystallization properties and solubility, etc. When these two different salts, diastereomeric salts, have different solubility, then we can differentiate them, or we can separate them by crystallization. This is actually done here. You guys all know how racemic mixture can be separated by forming forming salts followed by crystallization. This strategy has been used here. You guys all studied this strategy in your stereochemistry classes. So after obtaining the pure optically active L isomer, this is the L isomer is actually the isomer which is actually active, biologically active as a antibiotic agent. So we get this L isomer as a pure stereoisomer, and then we treat them with this ester. Sorry, there will be two chlorine groups here, so we will get this chlorinated compound, which is called L-chloramphenicol. This is the biologically active isomer. Okay, so we finished the discussions of the retrosynthetic analysis and usage and side effects of all four drugs, which are under my topics. The rest of the drugs will be discussed by your PT sir. And okay, so the drug discovery, development, drug design, all these topics are completed. You guys study well, and okay, thank you for your attention.